be doing some activation, some inhibition, some lengthening, as well as some integrative movements for the knee valgus position, as well as limited knee flexion for assignment 3. So first we're going to start off with the self-induced myofascial release to inhibit. And so we're going to use a foam roller this time, not a massage ball. And we are going to do the calf. So what we're going to do is we're going to sit on the floor. We're going to put the foam roller perpendicular to the calves. We're going to put the hands, place the hands behind ourselves, lift those hips up, and contract that core to stabilize the thorax. We then can roll forward and back just to kind of get an increase in blood flow to this space. Warm it up, get it ready. What I would like to see is to be doing that soleus complex as well as that lateral gastroc and kind of trying to stay away from that medial aspect of the gastroc. So how we do that is we're actually going to stay in a neutral position, cross left leg over right leg to add more pressure to the right leg. Lift those hips up, and then kind of rotate to that lateral side. When we get in the top of the calf, that gastroc area, we may feel a nodule that is tight. When we get to a place like that, we're going to stop, hold this position for roughly about 30 seconds or so that we can inhibit those muscle spindles and really look for an increase in range of motion here. So, in that dorsal flexion of the ankle. So again, kind of finding that lateral calf, a little bit of that soleus complex there, and holding for 30 seconds. Now, if people are having difficulty with their shoulder strength, with their core strength, we can have them in this position with that foot crossed, just finding those nodules, finding those areas that they need to work on and adding pressure. They don't have to lift their hips. So once we've done that right leg, what we are going to do is also do the left leg. So crossing that right leg over, rotating that calf to the outside, so external rotation of the hip just a little bit, and getting really that lateral gastroc. So a lot closer to the knee on that lateral insertion site or origin. And really trying to find a good nodule there that we're tight, and then holding for 30 seconds. Again, if people aren't feeling as much, if they're not as tight in this space, getting a massage ball will decrease that surface area compared to the surface area of the foam roller. It will be a little bit more pinpoint. They can do it with the massage ball. So next, after the gastroc, is going to be the vastus lateralis, so that outer thigh here. Oh, my little foam roller escaped me. So what we're going to do is, for the vastus lateralis, is we also want to do the TFL, the tensa fascia lata. So we're going to kind of do two in the same. We're going to come on our left side here. We're going to place our left hand down. Keep that ab so we're not dipping, but we're not also over exaggerating here. Keeping that thorax nice and neutral. Some people like to stack. If you'd like to stack, it adds more pressure on that hip. Feel free. If we're having trouble with that hip, we can cross that top leg over, putting some pressure into that top leg to take pressure off the hip. We then are going to roll over that tensa fascia lata. When we find a space where it is a little tight, there's a nodule, maybe there's an adhesion there, we're going to stop, hold for 30 seconds, and allow that to inhibit. With the vastus lateralis, we're actually going to creep, ooh, that's tight right there. We are going to creep from the hip to the knee very slowly, but also kind of finding those nodules along the way, holding for 30 seconds. If we get to a space, we want to also remember to relax that quadricep, that vastus lateralis, and not have such a tone pulling that kneecap up, contracting the quadricep. We want it to relax. We want it to inhibit. So we do want to make sure that we are relaxed a little bit, allowing that pressure in the hand with a nice spongy elbow, keeping that shoulder nice and strong, using that core to kind of take some of that weight off. And then you can even put your hand in that other leg if we are so much having too much pressure in that hip that's being worked right now. So then we want to make sure that we're kind of getting and creeping a little bit more. That vastus lateralis is very close to that IT band. So we want to make sure that we're getting that vastus lateralis, finding that muscle belly, holding to inhibit for 30 seconds, and creeping even closer to the knee. If you need to put your hand down here, I do sometimes suggest doing a fist instead. Sometimes people have trouble with extension of the wrist, so doing a fist instead will give them a little bit more support in that neutral wrist position. All right, so once we've done the left side, we will go over and do the right side. For time's sake, I'm going to skip the right side, and from here on out, I'm just going to do the left so we can see from a frontal view. The next area that we're going to do is going to be the biceps femoris. Biceps femoris is going to be on the outer thigh of that hamstring. So in the back of that thigh on the outside rather than the inside. We will be doing the inside later, but what I want us to do is I want us to lift up those hips, hands behind the shoulder or at least in line with the shoulder, spongy elbows, use that core to lift those hips up, and externally rotate that foot. We want to kind of find those nodules in that lateral hamstring, and then hold for 30 seconds. If they need more pressure, cross that foot. If they need less pressure, hips down, still cross that foot to add some pressure to the thigh. If they want more pressure than this, but less pressure than here, uncrossing that foot, having them kind of equalize that pressure there. Then you want to kind of even get closer to the knee. If they do just want to roll, go from the glute fold all the way to the back of the knee with that foot externally rotated. We don't want to get that medial hamstring. We want to end up strengthening that medial hamstring. So we are going to roll from hip, glute fold to knee, and never over a joint. The next area we're going to do, still staying on that left side, is going to be those adductors. So what we want to do is, this one is a little bit difficult for people to get into, so this is one that I kind of get on the floor with them and work it out. Angulation of how we have the foam roller is different for people. Some people like it externally rotated, some people like it internally rotated, so what works for them will be best. So what we're actually going to do is almost straddle this. We're going to start in a quadruped position, lift that left leg over, and then I like to actually internally rotate. Let me slide this back here. And then we're going to be into that plank position so that we can lower our hips onto the foam roller, get onto those elbows, and keep those hips neutral with the core. I don't want to see dipping. I don't want to see exaggeration. This is a hard one for people who have lack of core stability, core strength, or have a compromised strategy for using their core. We then want to roll all the way from the outside of the knee, the inside of the knee to the inside of the hip, finding places where we've got a nodule. So right here I'm pretty tight, keeping those hips contracted. And if you want, you can even elongate that leg. Rolling again. If they're having trouble with their core, they can place that not being used leg on the knee so that it's no longer up, but it's now been dropped, and they can even pick it up so that they roll that patella over that patella so they're not right on that knee. You can even put a pad there. Kind of shifting those hips left and right, finding those nodules. So I've got a nodule right about here. I'm going to shift my hips over, pick that knee, put that knee down, pick that foot up, and hold that for 30 seconds or so. All right.
So to recap,